Had a prednisone warrior ask about psoriatic arthritis, I think. She said, I have inflammation from PsA, finger joints and lower back. Doctor prescribed prednisolone for short-term usage. Have not taken this for a while. I have 25 milligram and 5 milligram bottles. My fingers are especially stiff, swollen the last few days. I recall him saying take for 5 days, but I'm not sure what dosage. Also on methotrexate and purulent. So thing I have to say before I can give you medical advice is this is not medical advice. And this is just based on the very limited information I have here. And I am not your doctor. Your best information is from your doctor. But what I'm inferring based on what you've written here is first that PsA stands for psoriatic arthritis, a type of joint pain from psoriasis, related to psoriasis. And the fact that your doctor prescribed prednisolone means that you're not in the United States. And also the drug Purulin is not in the United States. So I'm just inferring that you are international. And so now you're wondering essentially what dosage of prednisolone to use while you're having a flare of psoriatic arthritis. And that's a great question. And I have helped a lot of people with psoriatic arthritis because I was asked to approve their requests from their insurance company to get expensive biologics. I'm not sure what's available in your country though. But essentially, for this condition, there are a lot of alternatives. I'm not sure why your doctor's having you go straight to the prednisolone. I I mean, I see that you're on methotrexate and Perlin, but like there are lots of injectables and other things that work now too. But if the last ditch effort is I've got to just get through this really stiff time, then the question is what dosage to take. And there's not a lot of great information here. I'm just going to read this from Up to Date Online. This is the most elite, best medical information available. And it says the use of oral glucocorticoids like prednisolone in patients with psoriatic arthritis should generally be avoided. They could be prescribed for rare patients with severe flares that aren't responding to conventional or biologic DMARDs. And but when they did a review of the studies, it showed that the steroids are associated with a low risk of flare affecting the joints. But it's really important to taper them slowly and in close observation with these patients to avoid development of erythroderma or pustular psoriasis. Yikes. So if you start taking it, don't just stop taking it. You need to go off slowly. And finally, they said, in patients requiring systemic glucocorticoids, such as oral prednisone or prednisolone, the lowest dose necessary should be employed. So essentially, the lowest dose you can possibly use that is helping you. And so if you have a 25 milligram and a 5 milligram bottle, I would start with 5 milligram. Just see, is one pill of 5 milligrams going to be enough? Is it going to provide you relief? If not, take 10 milligrams. But again, I'm not your doctor. And so calling your doctor's office is probably the best option. But based on what this is saying, the lowest dose is the best strategy. And then once you use it, taper off and do not just suddenly stop taking it. So hope that helps. Talk to your doctor to get a more clear answer about your dosage. Signing off is Dr. Megan, your prednisone pharmacist.